The male and female reproductive systems. This information can be found in chapters 10, 51, and 55 of your textbook. The first several slides are the combining forms and prefixes and suffixes related to the reproductive system. So reproduction includes several processes. So first, the production of gametes, which are eggs and sperm, the preparation of the female body each month for possible pregnancy, and then fertilization, which is the fusion of the sperm and the egg. These are the parts of the male reproductive tract. The penis delivers semen into the female reproductive tract. It's covered in foreskin. It contains spongy erectile tissue that fills with blood. The prostate is the size of a peach pit. It produces a milky fluid with sugars and enzymes that are ingredients in semen. It dumps fluid into the urethra. The vas deferens transports sperm during ejaculation from the epididymis to the urethra. That's what's cut when a patient has a vasectomy. The seminal gland creates 70% of semen, which is the fluid that carries sperm from the male reproductive tract. It creates a fluid that is basic, contains sugars, and helps sperm swim to the egg. The epididymis is a coiled tube on top of and to the side of each testes. This is where sperm mature for 20 days and then gain the ability to swim. And it's where sperm ejaculate from. The urethra is a tube that passes semen and urine out of the body. The scrotum is the sac of skin that hangs outside the body and holds the testes. It's divided by a septum. It can pull the testes up and down to stay at the appropriate temperature for sperm production. The scrotum is made of skin and muscle. The testes are where sperm are made starting at puberty. It's divided into 250 wedge-shaped compartments filled with seminiferous tubules or sperm factories. The testes develop in the abdomen and descend in the scrotum before birth. Testosterone, the male hormone, is produced in the testes. The hormone is needed for reproductive organ function. It is also needed for the development of the male secondary sex characteristics, such as facial hair, pubic hair, hair on the arms, chest, and legs. So the anatomy of a sperm. Sperm are produced by the male reproductive system. The sperm combines with the female egg and contributes half of the genes of offspring and determines gender. So the acrosome is the top of the sperm. It contains enzymes that digest through the egg. The head of the sperm contains DNA. The midpiece contains mitochondria, which create energy for the sperm. And then the tail has flagellum for propulsion. So flagella are hair-like appendages that provide motility, and they help propel the sperm forward. So now we have the female reproductive tract. So the ovaries are where the eggs are made before birth and stored. They're filled with follicles that each hold one immature egg. Each month, one follicle ripens and releases one mature egg. This is called ovulation. The ovaries secrete the female hormones estrogen and progesterone. These hormones are needed for reproductive system function. They are also needed for the development of female secondary sex characteristics, which include increased breast size, pubic hair, and widening of the hips. The fallopian tubes receive the ovulated egg from the ovaries. This is where fertilization occurs. So that's when the sperm meets the egg. The fallopian tubes are filled with cilia and lined with smooth muscle to push the egg toward the uterus. The ovarian ligaments attach the ovaries to the uterus to hold them in place. The uterus is also known as the womb. That's where the baby develops. It's hollow with thick walls made of muscle. The lining is called the endometrium. The uterus receives, captures, and nourishes the fertilized egg. The cervix is the neck of the uterus. This leads to the vagina. It's filled with mucus that prevents bacteria from the vagina from entering the uterus. The cervix opens during menstruation and birth. Finally, the vagina receives semen during intercourse. It provides a passageway for delivery of an infant and for menstruation. The mammary glands secrete milk after childbirth. The glands are on the outside of the chest. They're made up of glandular tissue and fat. Milk drains into ducts that open onto the nipple. Menstruation is the process in which the lining of the uterus, or endometrium, breaks up and is discharged from the body through the vagina. The endometrium is rich in blood to nourish the cell that grows into a fetus. If pregnancy does not occur, menstruation begins. Menstruation occurs about every 28 days, and the menstrual flow will usually last about 3 to 7 days. Ovulation usually occurs on day 14 of the cycle. So you have menstruation, then ovulation, then estrogen and progesterone cause the endometrium to thicken. If pregnancy does not occur, the hormones will decrease and the endometrium will break up, and that is what is menstruation. Fertilization and implantation. Fertilization is the uniting of sperm and the ovum into one cell. The sperm and the egg unite in the fallopian tube. A sperm has 23 chromosomes and an ovum has 23 chromosomes. When the two cells unite, the fertilized cell has 46 chromosomes. A zygote is the fertilized egg. Implantation is when the fertilized egg burrows into the lining of the uterus. Sex is the physical interactions between people involving the body and reproductive organs. Sexuality is the physical, emotional, social, cultural, and spiritual factors that affect a person's feelings, attitudes, and behaviors about one's gender identity and sexual behavior. Sexuality is important throughout life. Attitudes and needs change with aging. They are also affected by life events, such as divorce, injury, illness, and surgery. Erectile function is an example of an illness that can affect sexual function. Erectile dysfunction is the inability of the male to have or maintain an erection. Sexual orientation refers to the emotional, romantic, and physical attraction to men, women, or both sexes. The term heterosexual refers to a person who is attracted to members of the opposite sex. Homosexual refers to a person who is attracted to members of the same sex. Bisexual refers to a person who is attracted to males and females. Gender identity refers to a person's sense or feelings of being male, female, or a combination of male and female, or neither male nor female. The term transgender describes people who express their sexuality or gender identities in ways that do not fit with their biological sex. Love, affection, and intimacy are needed throughout life. As people age, hormone levels decrease. Women go through menopause, which is the time that marks the end of the menstrual cycle. The epididymis, seminal vesicles, and prostate gland lose some of their surface cells. Testicular tissue mass decreases. The prostate gland enlarges. Age does not predict male fertility. So the frequency of intercourse may decrease due to weakness, fatigue, pain, reduced mobility, and chronic illness. Married couples can share the same room in nursing centers. That's a requirement of OBRA. And sometimes relationships develop between residents of nursing centers. A healthy person is able to control sexual urges. However, changes in the brain and mental function make control difficult. Sometimes touch is used to gain attention. For instance, a patient grabs a caregiver's leg. This behavior is not meant to be sexual. Inappropriate sexual behaviors may have causes. So nervous system disorders, confusion, disorientation, dementia, medication side effects, fever, or poor vision. Sexually aggressive behaviors may be about power, control, or fears about sexual function. It's important to remain professional, stand back from the person and move the person's hand away, and then discuss the matter with the nurse. Sexually transmitted diseases are passed from person to person during sexual contact. They're also known as sexually transmitted infections. Those caused by a virus cannot be cured. So some of the most common are chlamydia, which is a bacterial infection. Both men and women can become infected, and babies can become infected during childbirth. Genital herpes is caused by the herpes simplex virus. Sores can appear on the genital or rectal area, buttocks, and thighs. The virus can spread when sores are not present. Babies can become infected during childbirth. Outbreaks occur where the virus entered the body. Sores are blisters that break and become painful before healing. The virus stays in the body for life, and repeated outbreaks are common. Gonorrhea is a bacterial infection that can infect the genital tract, mouth, or anus. Babies can become infected during childbirth. There may be no symptoms. If there are symptoms, men can have pain on urination or discharge from the penis. If untreated, prostate or testicular problems can develop. Women may experience bleeding between menstrual cycles, pain on urination, and vaginal discharge. If untreated, pregnancy and fertility problems can develop. HIV/AIDS is caused by the human immunodeficiency virus. The immune system is harmed. White blood cells that fight infection are destroyed. The person is at risk for infections and certain cancers. AIDS is the final stage of HIV. HPV is a group of viruses that cause warts on different parts of the body, including the genitals. It's the most common STD in the United States and can cause cancer. Syphilis is a bacterial infection that infects the genital area, lips, mouth, or anus in men and women. Babies can become infected during pregnancy. At first, a single small painless sore develops, and then symptoms may come and go for years, and if untreated, it can cause death. Trichomoniasis is caused by a parasite. Men usually do not have symptoms, but women develop vaginitis, which is discharge, odor, and painful urination.